Hi, today we're gonna talk to you about Guillain-Barré syndrome, a rare but very dangerous condition. Actually, Guillain-Barré syndrome is autoimmune inflammation in a form of acute inflammatory polyneuropathy with resulting of muscular weakness and diminished reflexes. Uh, Actually, this is a French neurologist Guillain who, together with his friend Barré, described two cases in French army during World War I. We have 1 to 3 cases per 100,000 annually. All age group could be affected, but we have two peaks in from 10 to 20 years and 70 years plus. More male could be affected, and lethality uh, depends of the severity. Usually, patients on mechanically ventilated lungs have much higher lethality, up to 18%. We have etiologically, we have bacterial or viral illnesses in anamnesis, usually 10 to 14 days. Uh, Most commonly, it is Campylobacter jejuni, cytomegalovirus, and now they describe COVID-19. Actually, such case was in my relative 2 months ago. It was post-COVID Guillain-Barré syndrome. Sometimes vaccines, but these cases were described in 70 years. What is the mechanism? It calls molecular mimicry. So immune system attacks lipopolysaccharides on the membrane of the virus or bacteria and create special antibodies which attack myelin, the fatty coverage around peripheral nerves. Locuses of damage usually are on peripheral nerves, as I said, but cranial nerves could be affected too. There are a few forms of GBS. Usually we have acute inflammatory demyelinating polyneuropathy. It is about 70%. But also the most severe form is MN with the problems with the breathing, and Miller-Fisher syndrome. It has triad of areflexy, ataxy, and ophthalmoplegia. We have sometimes combination, but very rarely. Clinically, as I said, it depends of subtypes, so depends of previous types, but we have progressive weakness of muscles, dysesthesias of fingers and proximal muscles. Progression depending also of the form, but usually it's from hours to a few days. We have muscles of respiration affected, so it could be effect as a failure of breathing. Other symptoms, as we see, sometimes cerebral nerves are affected, which could cause problem is in movement of facial muscles, ophthalmoplegia, and talking. Also, polyneuropathic pain, usually a severe pain that could be managed with these patients. And autonomic nervous system problems, such as problems with heart rhythm, urinary retention, and paroxysmal hypertension. We have in a patient with a respiratory problem due to failure of respiratory muscles, we have these symptoms as exertion of on dyspnea, shortness of breathing, and such patient need emergent treatment in emergent care. Usually, there are 1/3 of such patients. Diagnosis is based on clinical signs, as I said, muscle weakness and peripheral nerves pain and deep feeling problems. EMG, electroneuromyography, is very helpful in diagnosis. It shows the problems in conduction of signal. Cerebrospinal liquid also shows the increased level of proteins. Peripheral nerves biopsy usually is taken for determining the group of subtypes of GBS, and other tests if there are some other problems. Management, usually those patients has to be hospitalized immediately. They are treated with intravenous immunoglobulins or plasmapheresis, depends on the form and possibilities. Respiratory therapy in those in severe cases. Also treatment of complications and fast rehabilitation. So OTs and PTs are needed in these cases. So our part of work, PTs usually work with the patient for increasing tolerance to physical activity, endurance, active muscle straightening, etc. OTs help to form positioning, posture, upper body strengthening, range of motion activities, etc. And some patient needs speech therapy. Prognosis usually is positive, so 80% independently walk in half a year, but some patient could not recover it totally, so some patient could move to chronic inflammation, demyelinating polyneuropathy, and some patients are not totally recovered, about 5 to 10%. Thank you. I want to say a few words about the ICF model in Guillain-Barré syndrome. So Guillain-Barré syndrome causes certain problems for our patients. If we talk about body structure and functions, so we have the respiratory muscle weakness that could and also lower extremities weakness. So it could cause the problems in walking and independent breathing, which could cause the participation restrictions in the form of visiting friends who lives on the third floor without the elevator, or for example if the patient took part in a chorus, so he or she can't sing anymore due to shrouded speech. If we talk about personal factors and environmental factors, so personal factors could be for example problems in acquire a new profession when the old one could be done due to weakness and due to this condition. And environmental factors could be described as if the person has a bedroom on a second floor and due to weakness in lower extremities he or she can't easily get to the second floor from the, for example, from a kitchen, which cause additional problems to such patients. Thank you.